The Palm Beach Civic Association brings you Studio 33480, delving into key issues impacting all who live or work in the zip code for the unique island of Palm Beach. This program is sponsored by the Fortin Foundation of Florida. And now, our host.
The skyline in West Palm Beach continues to change dramatically as more and more people and companies move to Palm Beach and across the bridge to West Palm Beach. In addition to Vanderbilt University building a graduate campus, one of the top-ranked hospital systems in the U.S. and the world, Cleveland Clinic, is expanding to meet the growing need for medical care as the population expands. Joining us today to talk about the new hospital and its impact is Dr. Conor Delaney, the Executive Vice President of Cleveland Clinic and president of the Cleveland Clinic Florida market and a world-renowned colorectal surgeon. Welcome. Thank you so much for joining us.
Sally, thank you very much for the opportunity.
You studied medicine in Ireland. You're here in Florida. How did that happen?
It's a long story. Studied medicine in Ireland and ended up doing colorectal surgery. And Cleveland Clinic in Ohio is the place to do and practice colorectal surgery. So my wife and I moved there 25 years ago for a year, and it's kind of been extended. And then 4 years ago we got asked to move down to Florida to look after the team here.
So Cleveland Clinic started over 100 years ago in Ohio. It's expanded worldwide. There's a presence in Florida. Tell us a little bit about the presence in Palm Beach County.
Yeah, absolutely. Well, very briefly, the presence in Florida. So the clinic started a presence in Florida in 1988, and our mission always is to serve more lives and do it as a tripartite mission, including research and education. And so we've built that footprint over the last 35 years, particularly expanding up on the Treasure Coast a few years ago. In Palm Beach County, we've had a presence for about 15 years. We have an outpatient centre in downtown West Palm Beach, and then we've got smaller facilities in Palm Beach Gardens and Wellington. But the demand has been strong for the brand and the care, and so what we're doing is trying to look at how we might expand those services to the community.
So some really exciting news recently that Cleveland Clinic is going to build a brand new hospital in downtown West Palm Beach, first one in a very long time. Tell us a little bit about the plans, what that will entail.
Well, maybe let me dive into what we have currently first. So we have about a 30,000 square foot outpatient presence, and we have in that outpatient clinics and some imaging, so radiology, and some cancer and medication infusions, but really it's a very small footprint. And if you're going to provide wraparound services that patients need, you need a bigger outpatient footprint, and I'll talk about that in a second, and then ultimately you need an inpatient hospital to look after the acute and severe and more complex care that patients need. What we're expanding to now is to a larger outpatient presence, which would be on City Place, and that'll be about 3 or 4 times the size of what we have now, and that will include outpatient surgery. That'll include more complex cancer services. That'll include broader imaging services and broader specialties. So we're providing a broader portfolio of care for the community. But again, as I said, if that's just outpatient elective care, maybe not just, but you also need that inpatient support network and an emergency care support network. So over the last few years, we've been working on a plan that might make that feasible. And as you said, it's come to fruition now. And so we're planning on having a hospital, an inpatient hospital, which would also be in West Palm Beach, just on Australian, north of Okeechobee. And that would have inpatient services. So think first the emergency room, stroke, heart attack, cancer surgery, more complex surgery. So really the wraparound services that patients need for emergency and a full portfolio of care.
Excellent. So you're expanding with the new hospital and at City Place. So two expansions there. Any idea when you'll break ground for the new hospital in downtown West Palm?
So the new hospital is going to be a partnership with the community, really, and we see it as co-investment of Cleveland Clinic and the community, and we will need some philanthropic support to do that. But in theory, the hospital could open as soon as the end of 2029. support notwithstanding that. So, we've got a lot of exciting support and conversations going on. We've already raised funds towards it, and some more to follow on that. What I can tell you is that we're going to be breaking ground on the City Place site in partnership with Mr. Stephen Ross and Related Ross actually very soon. That groundbreaking is coming up in the next couple of weeks. And we're excited about that because that alone is going to allow us to provide more services to the community in this bigger outpatient site.
It's great for the patients because as they go over the bridge, there are more options, more places to choose from for specialty care. Also economic benefits for the community. There will be more jobs. Can you address that as well? Because we have Vanderbilt coming in as well.
Oh, I think this is an amazingly exciting time for West Palm Beach and for the county, honestly. First, we've all seen the increase in the population over the last few years, maybe pushed on steroids by the pandemic with everybody moving to Florida. Part of that is that people and families need healthcare. It's one of the important things. So I think this will help allay that fear. It'll add a world-class brand, bringing multi-specialty care, giving coordinated care between that outpatient centre and the inpatient hospital to look after the community. But the real excitement, as you say, is everything else that's going on. So I think Vanderbilt announcing their plans here is very exciting. So if you think of adding healthcare, you're adding academics, you're adding training for people for high-end jobs, that can transform a community. The hospital itself, the estimate for a hospital like this, certainly once it matures, would be probably 2,500 jobs. But usually there's 2 jobs in the community for every job in a hospital. So really the economic support that the hospital itself will offer to the community as well is significant.
Why is it important for the community to buy into this?
I think just realizing the scale of care that's available at the moment, I think it shows the importance of adding care and of adding specialties. One of the things we love about this, when we provide care in different markets, we generally try and do it as part of an academic health system. So we have research facilities up the road. Down in Weston we have a full academic medical centre. And with that we try and build it into being an integrated healthcare network. So I think this is really important because it will add scale and services and brand and people to the community. But it also does it in such a way that this is fully incorporated with our Cleveland Clinic Weston facility and enterprise. So we're a very integrated enterprise. But what that means is it will bring this community easier access to things like complex redo cardiac surgery, to transplant surgery. For example, in Weston, we just completed a 500th liver transplant and a 300th heart transplant. These are really big, high-quality programs, and really they're tied into what we're doing here. So it's adding more than just a hospital. It's bringing a hospital to the community that's immediately fitting into an integrated healthcare network.
And people won't have to leave. Sometimes you hear people say, oh, they're going to another state, but they can go over the bridge. They can, it's
Absolutely.
going to be nearby.
Absolutely.
What sets Cleveland Clinic apart, do you think? You've worked there for a long time from other hospital systems, the approach.
Knowing the team so well over so many years, as you say, I think it's really the shared sense of purpose and commitment to mission. Literally in every meeting that we go into, our first conversation is around quality and patients first. And then the next most important thing to us is our team. So it's about caregivers and the team, because we know that we need the team to be able to look after the patients. But I think it's that shared sense of purpose to the mission, and realizing that the mission is broader than just providing individual patient care, which is the most important North Star, but it also has to include research and education, because if we're not educating the next generation, not educating the next nurses and physicians and other caregivers who are going to come to the communities, and not doing the research to improve the care in the future, we're really only providing part of long-term health care.
Wonderful, excellent plans, and we thank Cleveland Clinic for their support of the Civic Association, empowering us to carry out our mission to educate the community. So thank you so much, Dr. Delaney, for joining us today. It's been a pleasure talking to you.
pleasure was all mine, Sally. Thank you very much.
Thank you. And thank you for joining us in Studio 33480. Until next time, thank you for watching.
Studio 33480 is brought to you by the Palm Beach Civic Association and our sponsor, the Fortin Foundation of Florida. We welcome your thoughts on how our program can best serve our members and residents.